Okay. Oh, here she is.
Mr. and Mrs. Gibson.
Yes,
hello,
hi.
doctor. How are you?
All right, I guess.
Good. Well, look, everything looks good, so we're going to get you out of here today.
Oh, fantastic.
So you just need to relax for a little while longer, and
Okay.
we'll have everything written out. The nurse will be in shortly to go over everything with you,
All right.
both of you. So, go home. Stay home.
Okay.
All right.
Thank you,
Thank
Doctor.
you.
Oh, it's going to be so good to have you home.
Yes, and it's so good to be here.
Oh, Janice, I was just in with Mr. Gibson, and he's stable enough to be released. Since he had a stroke, I'm prescribing Digoxin and Coumadin to keep him slightly anticoagulated. I'd also like to have him set up with some home care visits.
Okay.
Make sure to call his PCP and schedule an INR for sometime later this week. His level's good at 2.6 right now, but we want to keep an eye on that. I'd like to keep his INR in the 2.5 to 3.5 range. Be sure to tell him to contact his PCP if he notices any unusual bleeding, like when he's brushing his teeth. Assure him that we'll keep an eye on his INR so that won't become a problem. No need to be alarmed or anything. We can manage with dose adjustments.
Sure. Was there anything else?
No, I think that's it.
Will you be documenting this on the discharge instruction sheet?
Yes, I am. Just wanted to review it with you as well.
Okay, great. I'll get his discharge papers ready.
Okay, thanks.
Hello, Mr. and Mrs. Gibson.
Thank you. Hey there.
hello.
So the doctor says I'm good to go home today. Is that right?
Yes, sir. It sure is. There are just a couple of things I need to make sure to go over with you, and you, Mrs. Gibson. Just want to make sure you have all that you need and answer any questions before we release you. Now, Dr. Fellows has prescribed Digoxin and Coumadin for you, okay?
What exactly are they for?
The Digoxin actually slows the pulse somewhat and helps the heart beat stronger. Now, Coumadin is what's known as an anticoagulant.
Oh, wait a minute. An anti-what?
An anticoagulant. Basically, it is used to prevent the blood clots from forming. Some folks refer to it as a blood thinner. It's important because you just had a stroke, and strokes may be caused by blood clots.
Oh, sure, that makes sense, yeah.
And what does the other one, the dioxys something one?
Digoxin. That's to control his heartbeat and improve the heart pumping function.
Oh, okay.
So Dr. Fellows has you on 0.125 milligrams of Digoxin, and looks like she forgot to write down a dosage for the Coumadin. Let me try and catch her before she leaves.
All right, I will keep packing so we can get out of here, too.
Okay, sounds great.
Dr. Fellows,
Yes, Janice?
I was reviewing Mr. Gibson's discharge with him, and it looks like you forgot to write down a dosage on his Coumadin prescription.
Oh, really? Well, I'm sorry about that. Good catch. He should take 2 milligrams a day.
Okay, great. Thank you. Would you mind calling Dr. Shaw's office and scheduling an appointment for Mr. Gibson sometime this week? We also need to get him set up with home health visits. Could you call his case manager and have her start that referral process?
Sure, no problem.
Make sure to let them know he had a stroke earlier this week and give them his background. His INR level is good at 2.6, but it needs to be monitored to stay within the 2.5 to 3.5 range. He'll need to have INRs done.
Okay. I'll let Mr. Gibson know what time I have the appointment set for before he leaves, and I will also call the case manager to let them know that he's ready to leave and that he'll need the home health referral.
Sounds great. Thanks, Jenny. Mr. and Mrs. Gibson, we're all set now. Sorry about that. Dr. Fellows wants you to take 2 milligrams of Coumadin a day. She made sure to write it on your paperwork so the pharmacy can fill it correctly.
Okay, great.
Okay.
Can I go now?
No, just a couple of other things.
Okay.
Jenny, the woman at the nurse's station right outside your door, is getting in touch with your doctor's office to schedule a follow-up visit with you, okay? Your doctor will be contacting you about getting some blood work done on a regular basis. This is how she will regulate your dosage of the Coumadin.
Okay.
She is also contacting Mary, your case manager, to get you scheduled for some home health visits. This means a nurse will be visiting you to see how you are doing. Do you have a preference of a home health agency?
We don't know anything about home health agencies.
Mary will provide a list of agencies in your area, and you will be able to choose one. She will help you with all of that. It is important for you to be followed by home health nurses. They will monitor your medications, possibly set you up for some telemonitoring until you're more stable, and provide more education. Telemonitoring is a little unit that will monitor your blood pressure and other vital signs. They also can provide some therapy to help you get around a little better in your home.
Oh, okay.
It's very important that you see your primary care physician, Dr. Shaw, in the next couple of days because we need to monitor your blood level to make sure that your medicine is the correct dosage, okay?
Yes, that makes sense.
Another thing, I don't want to alarm you, but just want to give you a heads up. Be extra careful when you shave or handle sharp objects because you may bleed easier due to your medicine, the Coumadin.
How's that?
When you're on Coumadin, you can bleed easier. Now, if you do accidentally cut yourself, don't panic. Just apply pressure and know that it may take a little longer for your blood to clot. You also need to let Dr. Shaw know if you have any unusual bleeding, like any blood in your bowel movements.
Clot?
Stop bleeding.
Oh, okay, that's right.
It's only an emergency if it doesn't stop after a while. I just don't want you to think it's worse than it is.
Okay, great. So, can I go now?
Well, I know you want to get out of here, but first, just to make sure we're all on the same page, could you repeat back everything I told you?
Okay, well, I need to check in with the girl before I leave to set up an appointment for Dr. Shaw, and Mary will be calling me to find out when my appointment with Dr. Shaw is, and Mary will be calling me to set up an appointment for a nurse who will do a home visit.
Which is a very important one, honey, because they'll be checking your blood levels.
All right, and also I need to pick up my medication as well.
That's right. And how much do you take?
He will take 2 milligrams of Coumadin and 0.125 milligram digoxin per day.
Great. Anything else?
Oh yeah, stay away from sharp objects. I guess it's a good excuse to stop shaving, huh?
Oh, you are so silly. He hasn't lost his sense of humor, as you can see.
Yes, I can see that. But please remember, you may bleed easier and longer than normal, okay?
Okay, and also tell Dr. Shaw if I have any unusual bleeding.
All right. Well, feel free to finish getting ready. After Jenny gives you your appointment time with Dr. Shaw, you'll be able to go. All of the instructions we just reviewed are in this folder for you to take home, okay? Take care of yourself, Mr. Gibson.
Thanks, you too.
And thank you for taking care of him.
My pleasure.